These are the things I need to make sure they know, to make sure that they know what's going on, so you can ask the right questions. Because if we're going to miss it, if your doctor's going to miss it, that's a lot of times is because we don't tell the truth. So we don't always tell them everything okay, and we'll just shake our head, go, yeah, everything's fine, and we forget to tell them, I've got this little ache or this little pain or this thing that clearly, because of your risk, because of your family history, because of what's going on with you, could be a heart attack. So we need to pay attention. Women are twice as likely to die after bypass surgery, especially if you're under the age of 50. So all those statistics, I am glad you are saying I could not be more thrilled that I joined this Lunch and Learn today, because she's given me just a bunch of bad news. What I've given you is an opportunity to pay attention to your heart health. What I've given you is an opportunity to take this information and still be here a year from now when Christopher invites me to come back for next year for Heart Month. And that would be a very good thing. So why are all of these statistics so high for women? I have a couple of personal theories. One is that we are simply just not aware. Now, we've done better. Since the Heart Association instituted the Go Red for Women movement, we have moved that bar somewhat. We have taken a little more initiative. Women are listening a little more. There's a little more information out there about it. And we're paying attention a little bit more, but not enough, because it still remains our #1 killer. Two, and this is probably the biggest one, is we're just afraid to find out. Sometimes we just don't want to know. We just don't have time for this, do we? No, we've got things going on, and I am not going to have a heart attack, and I am not having a heart attack because I am way too busy, and it's just not going to happen to me. And it's certainly something else. Number three is we just don't know how to find out. And this goes back to you being a very savvy heart health advocate for yourself, or just a health advocate of any kind. There are so many things out there that if you did your research, or you did your got all the information you needed before you went to the doctor, you would probably come out a little bit better and a little ahead of the game, because you could have the conversation and make sure they know. We as women are very, very bad just to shake our head and say, no, everything's fine. The other thing is we wait way too long. We will let this go for weeks. We will let it go for months. We will let it go for a very long time, because we don't want to know, or we're afraid to find out, because it's going to require something of us. And a lot of times we don't want to make the changes we need to make. We don't want to do what we need to do. So we're going to take a little time today to talk about what you need to be looking for and what you need to do about heart disease, especially identifying risk factors and warning signs. So for women, there was a Heart Association did a poll about 5 years ago now, and they literally went out and they asked women what they thought their #1 health threat was. What do you think the answer was? Breast cancer. That's right. We are all very fearful of breast cancer, and they thought that was their #1 health risk. Cardiovascular disease came in at the bottom 5% of what they were afraid of. The bottom 5%, and it is the #1 killer, yet it's ranking at the bottom 5% of what we fear the most. So let's talk a little bit. Let's just take a minute to talk about breast cancer. Now, I will let you know I am a breast cancer survivor. I am 6 years out, clean and clear. Yay for me. Bravo. Thank you. Clap, 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 clap. I appreciate that. But only 1 in 8 women will be diagnosed. Only 1 in 40 will die. So only 1 in 40 will die of breast cancer. And that's way too many. 1 in 40 is too many. But heart disease, it's still 1 in 3 or 1 in 5, depending on where, if you're looking at Heart Association or the National Institutes of Health. So now breast cancer is the second most common in women, but it is not the major killer. So awareness is important. And like I said, the Go Red movement has done a really good job of that. There's the Heart Truth, which focuses on women. And then there's Women and Heart, and they focus on women and heart disease. They have done phenomenal jobs. Now, one of the things, and this is not a knock to your primary care physician, your primary care physician takes good care of you, and I want you to listen to them, and I want you to go in to them with good information and being a good advocate for yourself. But when we were training our male physicians 20 years ago, 25 years ago, they taught them in school, don't worry about heart disease in women, because they don't get it, because they have estrogen and they're protected by their estrogen. And so they didn't train them to look for it. Now they've gotten better. They've gotten a lot better. So currently our new med students coming out, our new doctors, they know a lot more, and they've taken, they know that it does matter. They do know that, yes, we get some protection from estrogen, but not at the levels that we thought that would prevent us from getting heart disease. So awareness is key. You have got to know about heart disease and what you should be looking at, questions you should be asking, and activities you should be doing. So heart disease kills more women every year than all of the cancers, chronic lung disease, pneumonia, diabetes, traffic accidents, and AIDS combined. Wow, that's a lot, isn't it? So we need to actually be taking care of ourselves. So I want to talk to you about symptoms, risks, and treatment for women. And I told you that 2/3 of us will not feel that chest pain. Now, I told you I'm a breast cancer survivor. Now I get to tell you I am also a heart patient. So I have a huge family history. I'm going to take a minute and I'm going to tell you my story. So I had no clue I had any issue going on. I had the opportunity to volunteer here at the Heart Hospital. I am so blessed to have been here for 26 years. I was part of the original team that built the hospital, and it is a great blessing that the Lord has allowed me to stay this last 25 years and serve here the patients of the Heart Hospital and to be out in the community. I love getting out in the community, and I love getting to teach about cardiovascular disease. So that I got the opportunity to volunteer for something called a CT scan. So when you've been here as long as you've been, people kind of call you and go, hey, can you come help us out? They needed to learn. We got a new piece of technology. This was back in 2009. And they said, we've got a new piece of technology. Can you come guinea pig for us so the staff can learn how to use it? And I said, well, usually as long as it doesn't involve a needle or something like that, I'm okay to go play. But today they said this day, they said, now we are going to have to shoot a little bit of dye. So we're going to have to do a little bit of an IV. Is that okay with you? And they said, you will need a physician's order. So I happened to be around a lot of cardiologists. And so Dr. Henry was walking in the halls one day, and I stopped and talked to him. I said, hey, the girls in radiology want to do a CT scan with our new CT scanner on me. And we need a doctor's order because we're going to have to shoot a little bit of dye to see where that dye goes. And he said, okay, let's talk about your family history. I said, well, my dad died of a heart attack. He was just before 70, I think. I have a family history of diabetes. I'm fortunate I don't have it, but on both sides, maternal and paternal, we've got diabetes. I am not overweight. I call it just a little bit fluffy. And I'm relatively active, and I eat okay. I don't eat stellar, but I eat okay. And so he said, well, because of your family history and your age, at that point in time in 2009, I was 54. He said, because of your age and your family history, let's go ahead and do it. So we did. Well, I had it done, and I left that day, and I didn't hear anything from anybody. And I'm going across the parking lot one day, and Dr. Henry rolls up next to me in his Jeep, and he says, hey, I need to talk to you. So I said, okay. He said, come meet me in the cath lab. Now, typically here, when a doctor wants to talk to me, they want me to get them on TV, help them do something, get them a speaking engagement. They want something out in the community, which I am happy to do. So I went to the cath lab, and I was waiting. He was doing a case, and I waited and I waited, and he came out finally, and he said, hey, he said, I got the results. You did that volunteer CT scan for radiology. And I said, yeah. He said, well, they sent me the results, and you've got a narrowed artery. Now, the CT scan won't show us a blockage, but it does show us if we've got some narrowing in our artery. So it gives us an opportunity to say, I wonder what else is going on. So he said, because of your family history, I think it would be prudent to go ahead and do a catheterization on you. Let's see if there's any blockages. So I said, well, okay. So because of my family history and because of the age I was, we did that. Now, he says to me before the cath, he says, now, he said, Vickie, he said, I am sure I will get in there and I won't find anything. And I'll just make you clean up your diet, get some more exercise, and probably put you on a cholesterol medication. And I said, okay. So he sounded pretty confident. So I get in there and we're actually, they give you, when you're doing a catheterization, they give you what's called conscious sedation. So you can hear what's going on and you can see what's going on. You're awake. You're not feeling anything, but you're awake. So Dr. Henry says, Vickie. And I said, yes, sir. He said, you have a blockage and I'm going to have to put a stent in. And I said, wide awake, I said, what happened to diet, exercise, and a pill? And he chuckled at me and he said, we will talk about that later, young ladies. So I, since 2009, have been the proud owner of a stent. I had a close to 95% blockage in my LAD. The LAD is called the widowmaker, because typically if you've got a large blockage in that main artery and you have a heart attack, you do not survive. So he came to my room and he talked to me and he said, girl, he said, I'm so glad we did that. He said, had you had a heart attack, you would not have survived, because it was the 95% that it was and where it was located. So very, very fortunate that we found it. Now, I never had a heart attack, so I never had any pain. I never had anything really going on. I would tell you, looking back, the only symptom I had was I was so tired. I would get home and I would sit down, and boy, the minute I stopped going, I would fall asleep. I was just tired, and I chalked it up to getting older, 54, slowing down. I was working a whole lot. So I just really kind of blew it off. So this is what I do for a living, ladies and gentlemen. I get out and I talk and I educate on heart disease, and I blew it off. So if I blew it off and I kind of know what I'm talking about, makes me wonder what you guys are doing when you have a slight amount of chest pain or chest pressure, or you have something going on that you can't quite put your finger on. So I want you to pay attention to yourself, pay attention to what's going on. So let's talk a little bit about symptoms for women. They're not always the same as a man's. Once again, if we were in the room together, I would ask hands to go up and I would say, have any of you had a heart attack? Have any of you, and I would ask you what your symptoms were, and they'd be all over the place. They'd be from a headache to crushing chest pain to no chest pain to fatigue to, and here's one that will really kind of make you raise an eyebrow, is an impending sense of doom. You don't know what's wrong, but you know something's wrong. Now take that into your primary care doctor's office and ask them what they're going to do with that. A lot of times they'll pat you on the head and give you something for depression or anxiety and send you on your way. I want you to fight back. I want you to say, no, sir. I want you to say, no, ma'am. I want you to say, I have a family history of heart disease. I have high blood pressure. I'm a diabetic. Whatever your risk factors are, I want you to lay those out and say, can we please check my heart first? I want you to rule out that. A gallbladder, a hot gallbladder can mimic a heart attack, but I'd rather us check and see, make sure it's not your heart. And then we can go after that gallbladder if that's what the issue is. So a lot of this really is going to come back on you and your ability to communicate and your ability to say, to fight for your heart health, to fight for yourself, to be able to stay out there and stay active and stay functional. Women's symptoms more often are shortness of breath. A lot of times we will experience more shortness of breath. Back pain between your shoulder blades. Now, a lot of you will go, well, gosh, you'll write that off to sitting at your computer all day and being kind of hunched over, or gardening all day, or maybe you moved a piece of furniture last night. This is one that we really overlook. And a lot of times this is one that we see a lot of women present in the ERs with this sign, and it's missed because they're not looking for it. Fatigue, chest discomfort or pressure, nausea, sweating, weakness or pain anywhere between the jaw and the diaphragm. So that's a lot of space to cover. I would say this, if it's not normal for you, check it out. You should know your body so well that you would know this is not a normal pain for me. You know what your aches and pains are. And if something comes up and it's not normal and it continues to be prevalent, please ask your doctor about it and ask him, could this be my heart? Dizziness is another sign. So those are some of the symptoms that I call non-classical symptoms, more that we see more in the realm of women presenting than men. So we got to know what our symptoms are. Then you need to know what your risks are. I'm going to ask you to be able to tell your doctor what your risks are. What are your risks? Smoking, obesity, lack of physical activity, stress, waist circumference. If your waist is over 35 inches, your risk increases. Family history, your age, if you have high blood pressure, if you're diabetic, or if your cholesterol numbers are high. These are all risk factors. And you need to be able to, I call it building my risk profile. So me, I had a family history, so I started with a risk factor. I was aging, I have a risk factor. So if I had added anything else, I just built and built and built to that risk factor, was just raising my risk. Just 3 of those. If you just had 3 of the things I just mentioned, your risk for heart disease is 12 times higher than anyone else. That's pretty big, kids. That's pretty big. So know your risk factors. You need to know about treatment. Sometimes women are not receiving the same treatment as a man would receive. So you kind of have to know a little bit about what treatment is. I'm going to grab a quick drink. We know that 33% of heart attacks go undiagnosed in women. We know that about only 38% of women's physicians will actually discuss this topic with their female patients. So if you come in and you think it's a heart attack, they're not even really talking to you about it. You got to press it. 35% of us would be misdiagnosed by our primary care physicians. And even 18% of our cardiologists don't recognize heart disease as the woman's #1 killer. This is getting better, but that's kind of a startling number. You would think they check everybody's heart, don't you? Sometimes you got to press it. So clearly, as women, we need to understand our risks, our treatment issues, so you can be your own heart health advocate. So make sure when you go in, you're answering some good questions. I want you to be able to know, what is your blood pressure? Is it within normal ranges? If you have a family history of hypertension, you probably battle this, or you know someone in your family that does. Be compliant. Keep those numbers down where they need to be. The higher that pressure is, it's going to impact your cardiovascular health. And oh my goodness, the risk of stroke is so greatly increased by that high blood pressure number. So please be aware of that. Know what your triglyceride and cholesterol numbers are, where they should be. Check and make sure you're getting the right kind of exercise. Listen, good news for you. You don't have to own a single piece of spandex, and you don't have to join a gym. You can just get out and walk. Just get out and move. Park the farthest away from the grocery store instead of the front door. Walk. Take the stairs instead of the elevator. Walk, get up and take a break and walk around your office. Walk outside the building. You have no clue how important and how beneficial just simply walking can be. What's a healthy weight for you? Listen, we are not all going to be a size 0, a size 2, a size 8, a size 10, a size 12. We're not. So when do you feel good? When do your clothes feel good on you? When do you get good sleep? When do you feel good about yourself? I would dare say that's probably your ideal weight. And what are the right tests to detect heart disease in women? There are some different tests that are just better for women than not. So you need to be able, when you start down that journey of identifying heart disease, if that's what's going on with you, ask the good questions, because there are some things that are just better, that we get better results from on women than on men. So here is my takeaway for you today. I want you to develop your risk profile. I want you to know what your risks are. I want you to be able to communicate it and articulate it when you walk into your doctor's office. I want you to know what the warning signs of a heart attack are, because I want you to be able to take action. I want you to minimize your risk by being proactive. I want you to get on board for yourself and begin to take care and do the things that will make sure you're right in the chair that you're in a year from now. I want you to have a frank conversation with your physician. Don't be afraid to ask if certain tests are better or for certain tests if you suspect something is going on. And don't be afraid to talk about it. If you have a friend or you're somebody that you know that's had a heart attack, ask them about their heart attack. Ask them about what their warning signs were. Ask them about the tests they had. Ask them so that you can have that piece of information and add that to your arsenal of protecting yourself with heart disease. So I'm a survivor. I am a heart disease survivor. I had my cath and stent placed on a Friday. I was back in the office on Monday. I was back out on the dance floor the following Friday night, and I dance almost every Friday night since. So I stay active. I'm like I said, I'm still not the super best eater, but I do pretty well. I pay attention. I try to pay attention. So I want that for you. I want you to know these things. Christopher has a handout called Women's Heart, a Women's Heart, that goes over all the things I just talked about to you today. He's going to send that out. Please read it. Get your highlighter out. Highlight the things that you want. And if you have any questions at all, Christopher, I am happy for Christopher to give you my email address, and I will answer any question that I can if that's some information that you need. Thank you for sharing your lunchtime with me. I know that it's a break time for you, and we like to breathe a little bit, but thank you for allowing me to talk to you about something that is so important for me, and that is you guys need to take care of your hearts, and I want to give you all the information that makes that possible. Christopher, thank you for the opportunity, and for all of you out there, thank you for listening.
Thank you, Ms. Vickie, for this presentation. I appreciate it. I hope all the women on this Zoom call today got wonderful information that they can take and use from today moving on forward. One question I wanted to ask you, Ms. Vickie, I'm not sure if you did say this. Are there any particular foods that they should stay away from when it comes to having a bitter heart?
Yes, prepackaged processed foods are tough on us. You want to really be looking for a diet that's packed with fruits, veggies, and protein. We always teach to shop the outside of the supermarket. If you go down those center aisles, you're going to get in trouble. That's where the cereal is and the cookies are and the chips are. They're in those middle aisles. If you'll shop the perimeter, you'll get your veggies and you'll get your meat and proteins. You'll get your dairy that you need. So it really, it's really up to you to find the things that you like. There is so much information on nutrition out there for you. And maybe down the line, Christopher, as you develop out your program for the year, and you want a nutritionist to talk, I'm happy to get one of our dietitians to bring you some information and to do a Zoom call with you if you want to do that maybe later in the year.
Yes, that would be awesome. Feel free, please.
Yeah.
Does anyone have any questions that they would like to ask Ms. Vickie before we let go today? Let me check the chat box.
I have a
I'd love to answer some questions. Well, Christopher has my email, and I am thrilled if you want to email me, and I'm happy to answer those questions for you.
Okay, Ms. Vickie, we got one more. My coworker, we share an office, so that's why they notice what's going on.
Oh, okay.
I was just wondering what you had mentioned that some of the tests were better to show any heart issues for females rather than men. What were the name of those tests? I mean, is it just like a regular EKG, or is there something that works like what you said that we need to be getting instead of an EKG?
Yeah. So a stress echo ultrasound is typically better at identifying heart disease in women than just now. A standard EKG for any of us just becomes a baseline. So an EKG is good, but most of the time, what's the value of just a simple EKG is I can compare it. If I had one in January and I come back and have one in August, and I can look and I've seen changes, that's the value of an EKG. But if I don't compare it, then I really don't know. So a stress echocardiogram tends to be one that is very good for women and allowing us to really take a look at seeing what's going on. So that's the one where they bring you in, They lay you down, they'll do an echo, we call it an echo of the heart. So they'll take the echo and they'll roll it around, they'll take a look at your heart. Then they're gonna stand you up and put you on the evil treadmill. And they're gonna make you walk for 10 minutes. Hopefully you can do 10 minutes. And then they're gonna quickly lay you back down and see what that exercise did to that heart. Did it make it jump around? Did it make it not do something? So the pictures that they get these days are absolutely amazing. We have a screening here at the Heart Hospital. Okay, now this is where I roll into shameless self-promotion, Christopher. So we actually have a screening called Keep the Beat. And Keep the Beat is a screening we do here at the hospital. It takes about an hour to go through, and it will do, we'll do an EKG, we'll do a CT scan of the heart. Now the CT scan of the heart, that's what I had done where we found my narrowed artery. Doesn't show a blockage, but it shows us what the calcium buildup is in those coronary arteries. If you have a high calcium score, your risk of heart disease or there being something there is much greater. So it'll do a CT scan. We'll do a full lipid profile, which means we'll check your cholesterol, your A1C, your triglycerides. They'll do what we call a peripheral vascular assessment. So we're going to check your lower extremities. If I can have a blockage in my coronaries up top, I can probably have a blockage somewhere down in my legs. So if you're having swelling of your legs or something going on and pain in those extremities, we will assess that. It's called peripheral vascular disease. We will assess that. So there are 9 components that test does for $99. If you went to your doctor's office and had all those tests run, what I call rack rate, is about $2,500 worth of testing. So it's 99 bucks. You do it in an hour. You walk out with your results. A nurse goes over them with you, and we tell you everything we saw. If we see something in that CT scan that we don't like, we will tell you what your next step should be to go further to make sure there's something there. So that's a good way to get a baseline and a good way to see where you're sitting and what you're looking at. If you go out to our website, they're actually, I think, running a Heart Month special that you can get that for $45. So check out our arheart.com. It's called the Keep the Beat screening. And if you have a family history of heart disease or a loved one that has passed from heart disease, you might want to do that. If you've already been diagnosed with heart disease, have a stent, or have had bypass surgery, you're not a candidate. But if not, they're really valuable tests for that. But to answer the question about better tests, the stress echocardiogram tends to show better results in women than a simple EKG out there.
Thank you.
Welcome.
Thank you, Ms. Vickie. Does anyone else have any questions they would like to ask Ms. Vickie? If you don't have some now, you can message me, or you can message Ms. Vickie through her email and ask these questions as well. Let me look at the chat box. Everyone says thank you. Very good information. Thank you, Vickie.
Good. I'll be back in a couple of weeks, or one eye, Christopher. I'll be back, and we're going to talk about.
Yes. So next week, February the 15th, Ms. Vickie will be back, and she will be doing our second lunch and learn for Heart Health Month, and as well, she will be helping us with our blood pressure screening that will be on the 22nd of February. So we'll be seeing a lot of Ms. Vickie this month.
Yeah, that'll be good. Thank you guys so much. Once again, I know you gave up your lunch hour for this, and I'm so proud of you for doing so. Hopefully you walk away with one little piece of information that keeps your heart healthy.
Thank you again, Ms. Vickie. Thank you, everyone. And that wraps up today's Lunch and Learn.
Bye. Thank you all.
Bye, everyone.